So what distinguishes ExpertMRI from other privately held companies is the fact that we are a very research and innovation-based company. So a traditional MRI basically is done in a single position where the patients simply are put on a bed and they are laying down throughout the examination. A stand-up MRI basically allows the patient to be, for one thing, very comfortable because the magnets are vertical, so they're on the side of the patient, and there's nothing in front of the patient. So the patient literally watches television while the MRI is being done. So patient comfort is very good. Then the benefit of scanning exactly in the position the pain is occurring is that their treating doctor can then see in the position clinically when the patient is complaining of their pain, what body parts are being affected. So with the symptom-specific imaging from the stand-up MRI, the diagnosis is going to be more accurate and the treatment plan will be much more defined. So with the stand-up MRI, the patients literally are watching television because the magnet, instead of being circular and claustrophobic for the patients, the magnets are vertical. So they're on the side of the patients. There's no feeling of claustrophobia because there's nothing in front of them. So with the stand-up MRI, there's nothing in front of the patient, therefore there's no effect of claustrophobia. So the comfort comes from really the psychological effect more than anything else of being open versus enclosed. Yeah. So the patients find comfort for not being confined, and in fact, funny enough, they find comfort in the fact that they can actually get up and walk out if they need to, versus if they're in a closed magnet where, God forbid, an earthquake happens, what do? So psychologically, there's actually certain advantages to being able to say that you're in control of ability to actually move in and out of the machine. Yeah, so the patients do have that freedom to be able to get up and leave, and they have the ability to directly speak to the technician. So that is very true, actually. The patients have a lot more control of their being in this machine than in a traditional MRI. So when someone comes in with pain and you do an MRI and the MRI is missing potentially the pathology that they have, so there's a couple of major problems with that. One is that you may miss the injury in a traditional image when you're not looking at them in the position that's causing the pain, so that the doctor doesn't know what to do. In addition, the patient, if he or she doesn't know what's wrong with them, is psychologically affected to say, wait, why am I feeling all this pain when the MRI is actually not showing what's wrong? So that is why scanning in the position that's causing the symptoms is critical. Patients may know that they have a problem, but often others, if there's no problem seen on the MRI, others may also start doubting the patient. So why they're complaining or what's going on with them. Is this some psychological issue? Versus finding the problem and then defining it, and others can actually even look at it and say, yes, you have a real issue. It's absolutely critical. If anybody who's had an injury or has been sick knows that an immediate diagnosis helps not only physically attack the issue, but psychologically it helps a lot to say, hey, okay, this is the problem I have, and this is what needs to be done about it. As a patient, I think one of the things, in addition to what we talked about of non-claustrophobic and the comfort, the fact is that we have locations throughout California. And we make it really simple for the patients to schedule themselves due to the fact that we have long hours, we're open on weekends, and they get to choose the location they want to go to. In addition to that, we do have a portal in which their doctors can access their images 24/7 anytime they want and anywhere they want. So there are certain advantages that our company offers that most imaging centers don't. So MRIs have no radiation or any harmful effects. So with MRIs, there's no radiation and no harmful effects. Again, with innovation, right, we're actually looking at different methodologies of looking at diseases or injuries. Such as in whiplash scenario, we're able to actually look higher than a traditional MRI, traditional positions do. We're looking at the craniocervical junction where the whiplash is actually happening, and looking and doing research and publishing those findings in the position, of course, in which the patient is having their problems. We're also looking at traumatic brain injury and looking at new sequences to define when those kind of injuries happen objectively. So there's many people that live with back pain. In fact, back pain is the second highest reason for missing work in the United States. But it's not uncommon that there's no diagnosis properly done for the patients with the back pain. And people just say, okay, I guess I have to live with it. But those that have back pain know how severe and how debilitating it can be. So what makes Expert different is that what makes ExpertMRI different is that we are able to scan the patients in the position that's causing the problem. We're able to give them definitive diagnosis much more accurately than a traditional MRI center can. And it really allows the patients to be able to get proper treatment. We do have patients that have come from all over the world to come and get scans done at ExpertMRI. We've had patients from Australia and England, from the Far East, from the Middle East, let alone patients coming in within the United States to get MRIs done at ExpertMRI. Well, certainly their doctors can assist them with the proper treatment plan, as well as what let me get back to that. Because getting the proper diagnosis doesn't mean they can go on with their regular lives. It's just that they know that they have a problem, right? So let me say that again. So getting the proper diagnosis is critical for not only the treatment plan, but also how one adapts to that back pain in their lives. If it's something that's fixable, fantastic, get it fixed. But if it's something that's not fixable, at least you know what the problem is and how to adapt to it in the long term. So people have come to ExpertMRI from all over the world to get their back scanned. So we've had patients come from all over the world to get their MRIs done at ExpertMRI for their back problems. Well, ExpertMRI can provide for them a much more accurate diagnosis. It is critical for patients to be able to understand what's wrong with them, both physically and emotionally. So we can bring them in from anywhere, or they come in from all over the world, literally, to us. And we can give them much more accurate diagnosis. So if you've had back pain for years, ExpertMRI can help. If you get scanned in the stand-up or weight-bearing or gravitational position, your diagnosis will be significantly more accurate than otherwise. So we put people in the position in which the pain is occurring. Therefore, you can see anatomically what's really going on in that position versus simply laying down. If you have back pain, you really need to get the proper diagnosis done. If you do not have the proper diagnosis in place, your doctor does not know what to treat. The number one thing you must do is to get the problem identified before it can be resolved. So at ExpertMRI, we focus on back pain and back diagnoses. At ExpertMRI, we find pathology that has been missed on traditional MRI machines commonly. And it's sad that people have lived with pain for so long without having the proper diagnosis in place. So it's sad that people have lived with back pain for so long without having proper diagnosis in place. With ExpertMRI, it can certainly change for them. With ExpertMRI, they can actually get the accurate diagnosis for their injury, for their problem. So the main things that differentiates ExpertMRI from a patient perspective is the comfort, the non-claustrophobic effect, the fact that we can do heavy patients. So patients up to 500 pounds can be done in our centers. For the elderly or who cannot lay down for some reason and still need an MRI, ExpertMRI can provide that care while the patients are sitting or standing and getting their MRIs done. For patients that cannot breathe when they lay down, such as with congestive heart failure, ExpertMRI can provide that setting in which they can get their MRI done. For children that would normally have to be sedated in a traditional MRI setting, watch Tom and Jerry cartoons while the MRI is being done, with the mother or the father standing next to them. So it is very comfortable for a variety of different patients and advantageous for them. Okay. If you have back pain and you need proper diagnosis so your doctor can treat you properly and relieve you of the pain, ExpertMRI is the place you should get imaged. If you have a back pain, you need to get the proper diagnosis so your doctor can do proper treatment to relieve your back pain. Watching television while the MRI is being done really makes you comfortable, and the time goes by faster, because typically these are 20 to 30 minute exams. Watching television is also beneficial for children, because generally speaking, in a traditional MRI, a child has to be sedated and in the hospital with an anesthesiologist present. In the case with ExpertMRI, the child can be sitting there while the MRI is done, watching cartoons, and their mother or father standing next to them, holding their hand. I recommend ExpertMRI because proper diagnosis leads to proper treatment. So I recommend ExpertMRI because we are experts in back pain. I recommend ExpertMRI because we are specialists in back pain imaging. I recommend ExpertMRI because we're experts in back pain imaging. An accurate diagnosis leads to accurate treatment. ExpertMRI is focused on accurate diagnosis that then leads to accurate treatment. Absolutely, accurate diagnosis is key to accurate treatment. The key to accurate treatment is accurate diagnosis.